Illinois Governor J.B. Pritzker was in Carbondale today, celebrating a historic infrastructure investment for our area. That $2 million investment in Carbondale will go to reconstruct and modernize Poplar, West Cherry, and West College streets. The project consists of resurfacing the roads, fixing curbs and gutters, adding sidewalk ramps for people with disabilities, and including striping for dedicated bike lanes where possible. The investment is part of Rebuild Illinois, the largest infrastructure program in state history, totaling $50.6 billion over 6 years. Carbondale Mayor Carolyn Harvey issued a statement saying, quote, reconstructing Poplar, Cherry, and College streets is more than fixing pavement. It's about strengthening the heart of Carbondale. These improvements will make travel safer, support our local businesses, and improve access to Southern Illinois University and SIH Memorial Hospital, two pillars of our community. And new at 10, Illinois Lieutenant Governor Juliana Stratton was also in Carbondale today, turning her attention to rural health care. She hosted a roundtable with advocates and local leaders to address how federal policy changes could impact communities across the state. News 3's Wayne Walls-Parker tells us more.
More than 11 healthcare representatives from rural healthcare systems all over Southern Illinois attended a roundtable hosted by Lieutenant Governor Juliana Stratton. Her goal to find out how local healthcare systems could be impacted by funding cuts under the Trump administration.
To talk to people about what's happening on the ground and to carry their stories with us as we advocate to make sure that everyone has access to quality, affordable health care.
Stratton heard from healthcare representatives from Deaconess, Massac Memorial Hospital, and the Franklin Hospital. She also heard from representatives from ambulance companies sharing their concerns about emergency transportation to hospitals in rural counties, including Perry County.
So we have a small county ambulance service. There are 2 hospitals in our county, and so sharing that ambulance service and the resources that are very limited is very difficult at times. Oftentimes we struggle to get our patients transferred out of the county to larger tertiary facilities.
Health care providers shared their concerns about Medicaid funding, mental health resource availability, and other topics that go hand in hand with health care.
Because everything's interconnected, it's like links in a chain. And if one thing negatively impacts, it's going to impact then proverbially everything else down the line.
Stratton says she's taking those concerns back to Springfield and that her administration is committed to fighting for rural access, especially for maternal care.
But we want every woman to be able to have a healthy pregnancy, delivery, and 1 year postpartum. And this is another area where we can do more in rural communities.
Stratton says her office will continue meeting with hospital leaders and the governor's Rural Affairs Council to look for solutions. But she warns the state can't fill the entire gaps if the federal cuts move forward. In Carbondale, Waylon Walls-Parker, News 3.